Serratus posterior superior and inferior. The serratus posterior superior will elevate the ribs during inhalation. The serratus posterior inferior will depress the ribs during inhalation. So to palpate the superior posterior, serratus posterior superior, with the arm off the table, off the side of the table, which will pull the scapula laterally, locate the upper portion of the medial border of the scapula. You're going to ask your partner to inhale as you sink your fingers deep into the rhomboid fibers. Although you may not feel the belly directly, explore this region. And then inferior.
Let's do that. Hold on one second. Okay, so here's the medial border. Here's the inferior angle. So I'm going to slide up the medial border right to the top here, and then I'm going to sink in just medial to that. Okay. Superficially, I'm going to be on the trapezius, rhomboids, and then the serratus posterior superior is going to be deep to those two muscles. So I'm going to have Sue, I'm sinking in, I'm going to have Sue take a nice deep breath in into her ribs. Good, and relax and exhale. I'm going to have you do it 2 or 3 times. If I'm sunk in enough, I'm going to feel that, a little bit of that contraction of that muscle, okay? Because the other muscles are going to be relaxed since she's not adducting her scapula, okay? Very subtle though. Okay, now we'll do the next one.
Posterior inferior, you're going to locate the bottom of the rib cage, the 11th or 12th ribs, and ask your client to slowly exhale as you begin to roll your fingers across the muscle fibers.
Okay, so here's the 12th rib right here, okay? I'm going to slide just superior to that. I'm going to sink in, and I'm going to ask Sue to take a nice deep breath in.
I already did. Hold on a second.
And then a forced exhale. Good. Okay. Very subtle again. None of the other muscles will be contracting besides the diaphragm. Okay. That one you might have to play with a little bit to actually palpate it. Okay. Next.
The intertransversari. These short muscles span between the transverse processes. They are the deepest muscles of the cervical and lumbar regions and are nearly impossible to detect. Unilaterally, they laterally flex the vertebral column to the same side. Bilaterally, they extend the vertebral column.
They span from spinous process to spinous process, correct?
Looks like, well, from transverse process, I think.
Okay.
They span between the transverse process.
Okay.
Right.
So if I'm on the if I'm on the spinous process, I have to slide laterally. These are going to be pretty much almost impossible to palpate because there's so much soft tissue over top of them. Okay. Okay. Next.
Interspinalis.
No, that's the one I was thinking about.
Yeah. Extending from the spinous processes in the cervical and lumbar region, these short muscles help extend the spine. They are deep to the ligamentum nuchae. They extend the vertebral column.
Okay. So if I'm on a spinous process and I slide slightly either superior or inferior, I may be able to palpate the density of this small muscle. Okay? All right.
We're doing the ligamentum nuchae?
Yeah, we can do that right now.
This ligament is a fin-like sheet of connective tissue that runs along the sagittal plane from the external occipital protuberance to the spinous process of C7 in the neck. It helps stabilize the head and neck, and it is an attachment site for superficial muscles such as the trapezius and splenius capitis.
Okay, so my 2 index fingers are right on the external occipital protuberance right here. Okay, so the ligamentum nuchae starts here and comes down. How far does it extend to, is it C6, C7?
Yes.
Okay.
C7.
So I can feel the density of it when I slide laterally. Okay, medial and lateral. If she lifts her head up, extend your head, I can feel the density of the trapezius, but if I feel directly over the spine, then that ligamentum nuchae tenses. Okay, thank you. All right, that's
what-
good. That should be good.
Do you
Okay.
want to do the thoraco?
Yeah, let me get on the table for that.